How do medical authorities define intersex? Experts say it's when a child can't be identified as male or female because of physical variations, as well as less visible differences in a child's hormonal or genetic makeup. Experts estimate there's one intersex child born for every 1,500 to 2,000 births, but that's an estimate. Advocates say the number is much larger because of the difficulties in defining intersexuality. German lawmakers hope their new law will remove pressure on parents to opt for surgery on their children. Dr. Annand Saggar is a lecturer and senior consultant in clinical genetics, joining us now live from CNN London. Let me ask you, first of all, Doctor, to explain what we're talking about. For most of us, we're just mystified by this. What does it mean when someone is born with both genders or neither gender? Are we talking about people with the reproductive organs of both men and women?
Yes, I think that's a very common misconception, that when you're born with intersex, it's not about having both forms of genitalia, penis and a vagina. It's normally a disorder of sexual development, which means that you either have too small a penis for what you think should be a boy, or too large clitoris for what you think should be a female. So intersex is that sort of, I'm not sure what this is, really.
And typically what happens to children like that when they're delivered? Do parents just assign them a gender and have the child struggle to live it?
Yeah, I mean, as your piece first said, it's very uncommon to have a situation where you really can't decide whether this is a boy or a girl from looking at the genitalia. And that's, I put the figure in Europe at least around 1 in 4,500. But that's when you really can't decide. However, where a clinician is not really sure whether this is a boy or a girl, then that's about 1 in 300. So the confusions can sometimes occur quite commonly, but that's usually easy to sort it out, so that 99% of the time it's fairly obvious and clear which gender the child should be. The issue then is, of course, is what surgery is required, how effective that surgery might be, or how mutilating it might be, and then other issues and consequences about bringing up the child.
Does the German law make sense to you? Does it seem like a meaningful reform, or to be frank, does it stigmatize the child the second way? They've already got this predicament with their bodies, and now it's going to be on paper for the world to see.
I would agree that you have to be careful, and we need to differentiate between a birth certificate and a passport. I think, if I'm correct, in the UK at least, you have 42 days to register the birth, but in Germany you have 7 days. And in my opinion, that may be far too soon for parents to come to terms with what they're seeing in their child, for the doctors to have had time to talk adequately, for even some of the tests to come through to determine what the chromosomal genetic gender maybe of the child. And so I think there is a need for a delay. The question really is whether or not you can change that gender later on. Otherwise you stigmatize the child, and we have to give birth certificates for schools, and maybe the child looks very, very female or male. So you do need to have some leeway later on.